This is Susan. She's a breast cancer survivor and has asthma. Until recently, she was a bartender at this New York City theater. Then, the coronavirus arrived in the United States.
Everything's changed. I lost my job, I lost my health insurance.
That's because Susan's health insurance was linked to her job. Half of the country relies on this kind of insurance that's sponsored by an employer. And as U.S. unemployment figures climb to a historic high because of the pandemic, millions like Susan are also losing their health coverage.
Taking people already facing losing their job, already facing the disaster of losing their health and potential of their life, and facing a third disaster. Now they have no way to pay for it.
So how did we get here? To a system that relies heavily on employment for access to health care.
It's actually a historical accident.
Before the 20th century, there wasn't much need for health insurance because, well, there wasn't much healthcare to buy. Healthcare was virtually unregulated and health insurance non-existent. Physicians practiced and treated patients in their homes, and the few hospitals that existed provided minimal therapeutic care. With millions of workers going off to fight in World War II, the US faced a severe labor shortage in the 1940s. So businesses wanted to raise wages to attract labor, but economists had one big concern.
The federal government was trying to prevent wages and prices from inflating and going through the roof. So they told employers that there were wage and price controls.
And President Franklin Roosevelt signed Executive Order 9250, establishing the Office of Economic Stabilization.
If you needed more workers for your factory, because of defense production, let's say, the only thing you could do was offer more benefits. You had to offer them something like health insurance as an extra perk.
So that's what companies did. When the government ruled in 1943 that insurance paid by an employer was not taxable, it became even more favorable among workers.
After the war, it continued to be really popular because there were a bunch of people who had no health insurance, and then if you got a job, your employer would pay your health insurance.
By 1950, more than 70 million Americans had employer-sponsored health insurance. Today, it's more than 156 million, including the spouses and children of some workers, which means that the health coverage of entire families is at risk when workers get axed.
Bad things start to happen to people who can't pay their medical bills. They can enter bankruptcy, they can get their wages garnished, they can get a lien against their home.
So what other options do Americans have?
U.S. does not have a national health insurance system. We have a patchwork of different types of insurance policies, and that includes employment-based. Then we have public sources of coverage. Public sources of coverage are based on eligibility.
That can come in the form of Medicaid for children in low-income families or Medicare for people older than 65. If you don't meet either of these requirements, have no insurance through an employer, and can't afford your own insurance, well, you're out of luck, like Susan and millions of working-class families.
It's a scary thing because I'm at high risk for having a recurring case of cancer. The fact that my follow-up appointments for my cancer treatment are now potentially gone because I don't have a job is insane to me. It doesn't make sense.
Uninsured people have a lot of trouble getting medical care in the United States. The system is organized around a business model. If you don't have any money to pay, it's very hard to get a doctor to see you.
President Barack Obama tried to close that gap in 2010 with the Affordable Care Act.
We are done.
It actually did lower the percentage of uninsured people in the United States, but that number is going up again, which is not very reassuring during a pandemic where only getting tested for COVID-19 is free, but treatment for the virus isn't.
Going forward into this world where we're surrounded by viruses, and if you don't have insurance and you don't have money, you don't have healthcare. It's life or death. It's just cliche, but just very true.